Thank you for tuning into the Factor Care podcast. My name is Steven. I'm joined here today with Josh. And today he's going to take us on a little journey that he's recently gone through. So Josh, you recently had a knee replacement surgery. How about you go back to the very beginning of what caused this and take us through this journey with you?
Yeah, been actually trying to get this done for quite a few years. In 1998, I was a freshman in college, blew my knee out, playing a softball game, which ended in potential for a baseball career. Coaches weren't too excited about that, the JUCO I was at the time. And I was young and dumb. So being just about to turn 19, doing it right before then, my parents had left. I was, I'm a freshman in college. I'm in Louisiana by myself for the first time. Went to Tulane. They wanted the swelling to go down. I went back about 20 days later when the swelling had gone down, the bleeding had subsided a little bit. And what they basically told me is you've completely torn your ACL. Your meniscus is messed up. Your patella tendon even is. He said when I was rounding first base, and actually my leg planted and snapped out to the right side. So like if you look at your knee, it like not hyperextended like backwards, but did the same thing but went to the right.
But
So
I guess a little preface, a little bit more about your actual medical history and whatnot. So you're actually a severe hemophiliac.
Yes.
And you're 19 years old and you're playing baseball at a collegiate level. I mean, that's a lot of activity.
Yeah.
So, and you went through all that.
Yeah. And at the time they weren't doing the orthoscopic. This was right before they started doing that. And so I think 99 literally was the year that they had started doing it, because I caught wind of it, because of the friends that I had that had that surgery previously, just to repair the ACL and do whatever they were able to do at the time. They were still cutting you open. It wasn't like you had a small line incision or a couple of, holes and it was a full on major event. And, I after the ACL, when we looked at everything and I got the review back, I'm like, well, my knee feels okay. Like I'm not, bleeding anymore. I'm not having an issue. It's down, not realizing the damage I was going to do. And you jump from 98 all the way until I was 30 in 2010 before I had a surgery.
Wow.
So
wait, so in 99, you just blew it out. You actually didn't have the surgery yet.
I did not have any surgery. I just said, I'll get back to you.
With fact.
And I just told the surgeon too late, I'll get back to you. And I just never got back to him.
Okay. So 12 years actually from the time of injury to the time of surgery.
Right.
Now, during those 12 years, what was your treatment regimen? Were you already on prophylaxis?
Right.
Were you on demand?
So we had discussed this before a couple times on the podcast, but prophylactic treatment was something that was being discussed, but being born in 1980, a lot of fear associated with the tainted blood supply, and just it was more like you infuse when you have to infuse. The prophylactic treatment, that scheduled treatment, had not at that time really become a popular thing. So even though Tulane being in the forefront of kind of making that happen, I was not getting pushed to do it. I remember that. But they definitely wanted me to have something done surgically. And, again, 12 years. And I remember, and just, again, being in my 20s and just thinking, well, I'll deal with it when I got to deal with it. I can very vividly remember on multiple occasions playing tackle football, it kind of slipping out, and I'd come up with a routine where I would sit down, and eventually even getting my butt handed to me. I had some friends that at the time were fighting mixed martial arts internationally, and a couple were in the UFC, and I would go train, just get my butt handed to me, but I enjoyed it. And I remember throwing kicks and it just like slipping out, and you could feel it, right? So I'd have to sit down, and I would basically pull my heel on my right leg almost into my butt, like if I'm sitting down and just pulling it all the way to where I'm pressed up against, and after about 10 or 15 seconds I would just feel it just slip right back in.
Wow. And so my childhood was much different, because I believe in my grade school years I was given a list of things not to do, and tackle football, martial arts was on that list. So I didn't have all those adventures. But as far as our tuners that are tuning in, they may not know prophylactic treatment is treatment that's not on demand. It's used as preventative treatment even when you're not having bleed. And one of the factors that prevented prophylactic treatment from coming out so early for us was just the sheer cost of the drugs. So a lot of people don't realize that is that the drugs are so expensive. Insurance companies wouldn't say, "Oh, we're going to give you a medicine just because." But I'm shocked that during that time period they didn't have you regularly giving yourself infusions.
Yeah.
And obviously that may be what led us to current time
Right.
with what you just
Right.
went through. So then fast forward 12 years, you're getting your ACL replaced. Tell us about how that surgery went. How did
So in between those years, I had moved up to Nashville and actually went from the HTC at Tulane in Louisiana. When I went to Tennessee, they connected me with the HTC and at Vanderbilt, which they were amazing too. So I had two really good groups taking care of me over the years. But when they saw the information, I was pretty much harassed on almost a bi-weekly basis and getting calls from people saying, "Hey, you need to do something about this. Even if you don't feel it, there's microbleeds, like it's been slipping in and out. You're creating a lot of damage," which I was. But I think a combination of just a little bit of fear in the beginning of having the procedure done and knowing how invasive it was or was going to be, to just saying, well, I've been doing this for a long time and I know I can handle the pain and I'm just going to keep driving through and being stubborn and being difficult. And there's always pros and cons to things like that. This was a big con. This was probably, if I would go back and look at my entire childhood, adolescence into adulthood, and I know a lot of people deal with not wanting to infuse, and that seems to be those years, those late high school to early college years. It's like, well, I don't want to do this. I don't need to do this. I was going through that from the time I was younger all the way through into really adulthood.
Yeah, I can relate. Honestly, I was on demand the majority of my childhood until my late high school, early college years when I had surgery. When I was in college. So I was already in college. I had surgery on my right elbow, and that's when the prophylaxis really started for me.
Yeah. What year was that? Do you remember?
2005.
Okay, so that sounds about right. I think I remember hearing about it more and more around 2003 and 4. There was, I think Vanderbilt, along with Tulane, was kind of ahead of its class with trying to let people be more proactive about having patients do that more often and giving us really the right amount of medication to be able to appropriately deal with it. Because another thing was, I think there's a fear, and I didn't know this until, again, my 30s, realizing when I'm connecting with more and more hemophiliacs our age, was that there was always this internal fear of, well, if something happens or I don't get my factor on time and there's a breakthrough bleed, or that also made me want to stock up medication. Mm-hmm. And then finding out that pretty much everyone was doing the same thing I was doing, even though we weren't communicating with each other, some of us in different states, never meeting before. It was just like a natural fear of, well, what happens if I have a really bad bleed and I can't, it's not like we can go to the hospital.
Yeah, a lot of the hospitals associated with the HTC may have 1 or 2 doses available, but not anything significant, and maybe not even the product that you use.
Right.
But I think we all have similar journeys in which we have similar fears. Running out factor being a big fear, especially for us severes that take medicines more regularly than, say, a mild or moderate. But even beyond that, like the prophylaxis and the hesitance to do it, because when you're in your early childhood, you're scared of needles. Who wants to stick themselves often? Right. I mean, it's really something that mentally you have to prepare yourself for. And apparently in both of our situations, it was a major surgery in which we decided, like, hey, it's as real. And I think that also brings up a important topic of as far as prophylaxis goes and how we manage our bleeds, is the joint damage. Mm-hmm. When you have a major bleed in a joint, that joint after one bleed may be now a target joint, and not enough people know that. And so you're basically getting micro bleeds in that joint. Exactly. And the joint, and what people don't realize, those inflammatory mediators that come with that bleed, they'll eat up at the joint, and that's what led to my surgery. Yeah. I mean, my all the elbow bleeds I had over the years just totally just wreaked havoc on my elbows, and I had to have them surgically repaired. And you have to have your knee, but it's just something that, as a young child, wasn't talked about much, about target joints, about micro bleeds, and really they're learning a lot from our generation that has gone through. It's like, oh, well, now we're seeing that
Right.
you have 30 and 40-year-olds walking around needing knee replacements, elbow replacements, things of that nature,
Right.
and the importance of prophylaxis at such an early age. So now you have children, infants on prophy. I mean,
Yeah, and that was for me, and I don't know if this was the same for you, but I knew that, you know, at the age 30 that we were gonna have a kid for the first time. Just ended up with two amazing boys, but that for me really changed. And it may be different for everyone, but I think there's a lot of different changes that come with having your first child. But for me, in my experience, one of the things, other than really my mortality, was definitely part of that, but I was always pretty much aware. I think growing up, again, with the different circumstances that we were around, seeing other people in the hospital and even the oncology department where you're seeing kids with pediatric cancer and it's just horrible situations, I was very aware of my mortality, but I also thought I can grind through pretty much anything that it can throw at me. And that was that moment when I'm finding, okay, you know, I'm going to be a father. One of the things that really hit me sideways was realizing I finally need to figure out how much damage has been done, and then see what can be done to take care of it now, which is how you get forward to that 2010 ACL replacement.
mm-hmm.
So they took a cadaver patella tendon and replaced my ACL. They cleaned me up and did what they could with the damage that was already currently there, because there was quite a good bit of damage, to the point to where the surgeon was like, yeah, this is rough. I don't know long term what this looks like for you, but this should at least be able to stabilize the knee, and then we'll see, you know, how your body responds and go from there. Which was a heck of a process, and PT wasn't all that much fun, like any joint, elbow, knee. I find and I haven't had to deal with what you have with the upper extremities, but with lower extremities, the kicker for me is just gravity
Mm-hmm.
of your body and the weight of that added into the stiffness. And, you know, because I've only had lower extremity, you know, issues where I've had procedures done. But yeah, ACL replacement was 2010. And then you jump forward a couple more years and we were doing another knee scope.
So would you say that after, well, obviously that knee was an issue due to injury, trauma, but then after the repair, would you say that it became a target joint and it kept on deteriorating even further because of that? So that,
absolutely, yeah.
okay.
Yeah.
So then the ACL surgery, fast forward 2 years or a year, it went to a scope?
Yeah. I need to be cleaned out again. And again, an amazing surgeon and a great team at Tulane, you know, the hematology clinic, and Dr. Lessinger, and at the time, Karen Wolf, and them backing everything up. So I felt well taken care of. But what I had done and what he warned me about after the ACL replacement was the damage has really been done. So now it's just timeline, like how far, you know, can you get on this until maybe you can deal with it forever. He said, I wouldn't be surprised if you could, just because you're used to being uncomfortable. But at some point in time, this is going to hit you sideways and you're going to probably need to have a knee replacement down the road.
So wow,
kind of saw that coming.
Well, the conversations about knee replacements already had, and here we are 11 years later.
Yeah.
And you finally got a knee replacement done. But between 2012 and then, I know you had some other injuries and whatnot. So you had an ankle issue too?
So just like a low tire on a vehicle will kind of wear down on. So on that same right leg, my gait was off for such a long period of time at this point, for years and years. So from you know, the end of 98, you know, we're jumping forward to 2013. My gait had been off for so long. I had some bone spurs, had just a stress fracture, and some things that I don't remember exactly what they did. They definitely took care of the bone spurs when we did the scope. But so the ACLs in 2010, the knee scope, which kind of, I think, really showed us, you know, we're gonna have to deal with this. It's you're in trouble. Cartilage is really broken down. The microbleeding is really eating away, and just, you know, all the inflammation and everything that went into that. So I had done the damage by neglecting what I should have done years before. If you talk to my parents, they would probably tell you they're not surprised at all that I did exactly that and being hard-headed. But so ankle scope was in 2013, so the year after knee scope, and right after that, 2014 again, here we are doing another knee scope.
Wow.
So at that point, we got out of that surgery in 14, and he said, "There's nothing else I can do.
Mm-hmm.
You know, the next move for you is a knee replacement. There's no other area for you to go to."
And I guess that's something that people don't really realize unless they have an issue, is that when your gait is off, when how you walk is off due to injury or whatever, or physiological changes, I mean, it throws everything off. So you're putting wear and tear. Like
minor too. It doesn't have to be.
Because I'm flat-footed, and just because my feet kind of bend in like this, the ankle bones and everything else, or not pressing down the right way, putting stress where it shouldn't, and I have ankle pain, and to the point where I may pursue surgery. But yeah, for your instance, maybe your knee doesn't want to extend fully. So now every single step you take is at a different angle than how your body was designed to do it.
Right.
And, it's really important to take care of your body. When you go, I know with the comprehensive clinics, they usually have a physical therapist there. They have an orthopedist there, or may or may not have one, but they have all kind of different physicians there. And if they notice something, because I know when I went as a child, one of the doctors noticed that I walk a little different. So he told me walk down the stairs, walk down the hallway, and walk back. And he goes, one of your hips are higher than the other. So it's like it's going to throw off my back. And sure enough, my back was curved, my hip was off, one of my legs was shorter than the other.
Really?
Yeah, but the thing is that it throws everything off, which is going to throw us off in the future when all that wear and tear happens. I guess that's not talked about enough. And I guess we can think of like preventatively, when you go to these clinics, if they tell you that something's off, maybe that's something that we should look to correct, whether if you have a funny gait, maybe seeing a physical therapist or some kind of sports medicine doctor or something that can straighten up how you walk or how you land your foot, or just retrain it, because that's what the professional athletes do.
Right.
And they do it to prevent injury. There's no reason why a normal person like us shouldn't be trying to prevent injuries to ourselves also.
Right. And I was not only really active, but I'll tell you, I did work out a lot, and I was doing the best I could to stay in good shape, but that leg was just, the atrophy by this point too, and that quad on my right side it had taken a toll.
Yeah.
So you're more reliant, just with that gait being off, and then it being uncomfortable, your body just naturally, my body just started to depend more on the left side.
Yeah.
So, now I've got an atrophy issue, like my muscle is not doing what it needs to do, or being asked to do what it needs to do, because I'm pulling up a little bit, right? So like in that limp that I had, which my wife said she's never seen me without a limp.
Mm-hmm.
So I didn't realize it was as bad as it was when we met, and and that was in 2002. So it's been a long time.
We say limp, we say this injury, but a lot of it, we're downplaying the pain. A lot of people don't realize how much pain that a hemophiliac goes through on a normal basis, and we just don't talk about it because this is kind of life to us.
Yeah.
So it's like surgery and taking care of our bodies are great ways to decrease pain, but we push it off for so long. So we're kind of punishing ourselves sometimes. And you feel that's kind of the case in your situation?
Yeah, I think too. It's so important who's in your ear and who you're listening to. I have an extremely supportive family. Man, I am, when it comes to having real riches with family and support, I'm doing amazing. But one of the things that I heard, and I don't know if they told you this too, but one of the doctors actually told me, he said, you don't want to have the knee replacement done until you're so broken down that you're crying yourself to sleep every night.
Wow.
And so that kind of stuck in my head, and I'm like, well, I'm not doing that.
Yeah.
So it's kind of like, I guess, and I don't think that was necessarily the best advice now, but it was all I needed as ammunition in my brain just to keep driving.
Wow. So as far as my elbows go, I was an elbow replacement candidate, heck, 18, 19 years old. But at the time, the technology wasn't great. So the orthopedist pretty much said, like, hey, we'll do this synovectomy, radial head resection. That will hopefully alleviate the pain and get you better than what you are today, because the technology isn't there for the elbow replacements to last my lifetime, because at 20 years old, you still have a lot of life left.
Right.
But as a pharmacist working in the field, I mean, from a patient standpoint, I would have 70, 80-year-old men and women come into the pharmacy, and they were like, oh, I wish I would have done this sooner. I wish I was scared of getting cut on, and I didn't want to do it. And now I do it. I'm walking, and man, it's like I went 5 years in pain. I shouldn't have done it. I should have done it sooner. And from my understanding, like the large extremities, like your knees, are more robust, and they can handle the surgery a little better, and the technology's better.
It's amazing.
Yeah.
Now so it was Tuesday. So it was the Tuesday of Thanksgiving week. So it was 2 days before Thanksgiving.
Yeah.
And we only had about 10 days because everything got thrown together so quickly. So
you're talking about the knee replacement that just happened.
Right. That's a whole nother story. So I'm not trying to jump around too much, but the extra kind of 1-2 punch is then I began somewhere in that same time around 2014, 2015, I started to have some oral issues, which were bizarre. I mean, I'm talking about, I'm finally got my teeth in a place where I'm happy, and I'm going for the first time to get my teeth bleached, which was news to me. I never thought that, I'd do anything like that, but they were in good enough shape to where they were like, okay, you don't need to do anything else. Like, you can, swipe them up a little bit. So I'm going in to do that. And 2 weeks before I go in, I wake up one morning and 2 of my teeth are like chipped.
Mm-hmm.
And so that began a process of a couple of years. And it's the most bizarre situation. And we need to, at some point in time, talk to some more people that understand it better than I do. But I saw multiple different dentists, different oral surgeons. I started showing them the x-rays, because they have timelines on there. So they're able to see what was happening. It was bizarre. My bone was perfectly fine and healthy, but the enamel on my teeth was eroding at an exponentially fast rate that no one could explain why. We even did like a genealogy trying to figure out who's had, problems on either side of the fence. Maybe this is something that's hereditary. Maybe it's just not knowing. And we could not find anything. So
not even
this became a whole new
unhealthy
I know
addiction to Dr. Pepper.
Okay. All right. So leave Dr. Pepper out of this. But no, look, this is the thing. I worked out. I did what I felt like I could do physically, and I pushed myself a lot. I am horrifically bad at nutrition. Okay. So that's, yeah.
Well,
yeah, you name it.
Do you think that Dr. Pepper might have contributed to that?
And that was part of the conversation. But I mean, I had people go as far to say, you could not have taken any illegal substance that would have made this happen this fast. Within a 2-year period, I had like literally 3 whole teeth in my mouth. I mean, you saw me like one day we're eating at the office.
I've seen
this is recently, and literally I'm like, I'm going to take a bite of a soft taco from Taco Bell, and I go and it's like, and I just pull the tooth out and just put it on the table in front of you, because that's how it had been for so long. It was miserable.
Yeah. Well, I do recall many soft drinks, but not very many bottles of water that I've seen you drink.
I don't think any amount of water could have brought.
So it'd be curious. It'd be nice to know, like, hey, is that what it is? And hey,
sure, I think it played a role.
But then if you expand upon that, you had an extensive surgery to rectify the issue that you were having. And if you want to go into it, I'll let you. But the general message is like, hey, I mean, that required a lot of coordination. It required a lot of factor. It caused a lot of bleeding.
Yeah.
So maybe for parents of hemophiliacs, and then maybe young adults of hemophiliacs, they might need to realize, like, hey, oral health is a very important thing, because there's a bunch of dentists that won't see you unless you have a doctor's note and coordinate care. And when you need a root canal or an extraction,
It's a problem.
Well, a normal person calls the dentist and was like, hey, I have pain. Can I get it done? And it's done as soon as the dentist can fit you in. But for someone like ourselves, now it's, hey, I have this done. Oh, you have hemophilia? Now coordinate. It might extend the amount of time.
If they don't try to defer you to someone else because they're afraid of the liability.
Exactly. So I think that's something that's not talked about enough is oral care and dental hygiene associated with people with bleeding sores.
Yeah. And so the thing is I took care of my teeth. Like and that was what was so frustrating for me. It's like, this doesn't make any sense to them. I definitely don't have an answer for it. I love sugar. I think that if I had an addiction through life, that's it. Love candy, love Dr. Pepper for sure. But still no one's able to give me a definitive answer. Like it's just something was really wrong. And I know that the sugar played a role. I know that the caffeine, the Dr. Pepper, the
acid
played a role. Sure, absolutely.
Acid.
I'm sure it helped with that process being, so fast. It's expedited the way it was just unreal to everyone. So it's been a shock to people that have been doing this for years. It was a major shock to me. Thankfully, Dr. Lou, I grew up with an amazing, it's like my uncle, Louis Gennard, who went to our church, was neighbors with us growing up. And so he's amazing, understands the situation, has taken care of me my whole life. So, he saved my life. There was, when it started to get really bad, and my wife was, obviously we were always concerned about it, with infection. That was a major concern constantly. But if I kind of jump back just a little bit, 2014, we had that last knee scope where he says, okay, knee replacement is the only thing that's going to really fix this moving forward.
Mm-hmm.
We started the process then to try to get that procedure done within a next year or so. And we were running as like just beating one wall after the other and just with our face, and nothing happened. I mean, it was an amazing process to go through. And really, I felt like it was harder on my wife and the kids in my family, my parents, and even her parents, my in-laws, than it was on me. But we had 3 different hospitals, 3 different confirmations.
Mm-hmm.
2 of them the night before the procedure, after I'd gone through, you go through a little class, like, so they show you what, the walker, this is what's going to happen. This is how it's going to happen. Did it at 3 different hospitals. 2 of them, the board of directors called the surgeon and said, we're not going to let this happen. After my insurance had been cleared,
mm-hmm.
after the factor was already, we knew it was already, at the hospital waiting,
Mm-hmm.
all 3 of them said, nope, we're not doing it.
So this is the oral surgery or the knee surgery?
This is the knee replacement surgery that we were trying to have. So between 2014, the end of 2014, we started the process to try to plan that out, because we knew it would take some time and some planning and kind of to be able to coordinate something like that between Tulane, and the hematologist there, and then whatever hospital. And it was just banging my head into one wall after the other. And 2 of them were the night before. Like, we've got people to watch it. And this isn't anything more than me just saying it's difficult for us to have some of these procedures done.
Yeah.
And there's only so many people, to your point a minute ago with the oral surgery. It can be extremely hard, and not just on us, but really most of the time I feel like I would rather be hurting, but what I see it do to my family, and then if I see my family hurting, I kind of get that same, I felt for them, far more than I did for myself. But we could not get anyone to where the surgeon who had done all the other procedures, actually had, at one point in time, it took 8 months to get clearance and to go through all the red tape. Yeah. He had his entire staff that was going to a new hospital on the North Shore, with a great reputation, that they had already said, it's fine, we'll let you do it here. And we had checked with the board. And then the night before, they did the same thing after us planning all that out over 8 months. And it's not on them. I understand like the percentage increased liability that would come with someone like us on the table. But I had a really good track record. I've never had any issues, not allergic to anything. But again, it is difficult. And this is why it's so important to find someone that you can trust, that you can rely on. That's not only, first of all, a really good surgeon, orthopedist, or, whatever it is that you're looking for, dentist, but also that they can facilitate what needs to be done. And ultimately, we obviously just got that done with that same surgeon. And we only had 10 days, 10 or 12 days to map it out.
It popped up pretty quick when we found out you were having the surgery too.
Yeah.
You had a lot. You had a busy schedule. You were trying to coordinate all this stuff in a very short period of time once you got the green light. And I want to go into that in a second. But before that, I want just maybe a little bit of my own experience.
Yeah.
Now, mind you, our experience as far as the surgeries go is fairly different. But I understand that some people may want to use a different doctor, someone closer to home, someone they know, which is totally fine. And that's what you decide to do. I'm fortunate in that I grew up in a city, lived my whole life in a city with a HTC, and I always just used the providers that they dealt with there. So the care was more expedited. Mm-hmm. But with you being on the North Shore, knowing this doctor personally, that's totally fine. And I've met other hemophiliacs that were like, oh, well, you know what? I'm not finding the one that the Hemophilia Center deals with. I want to find the best one in the nation because I want whatever the cutting edge newest technology is. And then they can just coordinate care with the HTC as far as the follow-up care. Because at the end of the day, is our bodies are theoretically normal. So we can do the things that other people are getting. So why not get, the best elbow they make right now, the best ankle, whichever one pivots more, whichever one is going to give you more range of motion, whichever one is proven to use a smaller incision, whatever it may be, the reason for you to pursue the one that you have. But that leads us into that whole coordination of care, which you had to go through. See, as far as I've gone, Tulane did everything for me, but I've always been there for the past 40 years, and I just went with it. But for you had to do that. So I remember we were in Florida, and you got the green light, and it said, "Hey, your surgery's in
a conference for bleeding disorders."
Yeah,
and then they were like, "Okay, you have like 12 days." And really part of this was it came back on me that it took so long because I had to have that oral surgery where, again, two amazing guys coordinating to help me through that process, Dr. Jannard and then another physician in he's right outside of like Lakeview Hospital. But yeah, that was crazy because they had to extract, I think, 13 of the roots that were still left in my mouth. And then it was 14 posts that they installed for the implants, 7 on top, 7 on bottom. And we had to wait for that to heal, because that added to the timeline and everything else. So that happens in 2022. And it took, about a year and a half total, because it was towards the beginning of 22 that it happened. I think it was June, maybe May or June. So somewhere in there. Yeah, about halfway through the year. So I got to get my dates. But this is what happens when you have general anesthesia too much. Yeah. So this is a couple weeks back. But we didn't have much time. I know because I talked to you the same day I got the call.
Yeah. I mean, you got the call regarding the knee surgery. And literally, I was sitting there, I was like, well, what about the Hemophilia Center? Well, we're going to coordinate this. And obviously, you had to take all that on yourself. From my understanding, they did a great job coordinating. And that's something that, going back to the dental things, a normal person just has to show up. Someone with a bleeding disorder, they need more than just a dentist, or someone that needs a surgery. They need more than just a surgeon. They need someone, a specialist in hemophilia, whether they go see a hematologist or they go to their local HTC to figure out what's the proper dose. Or you're going to get an increased dose. Well, how much you're going to increase it? How long are you going to do that for? The follow-up care. And then you had to kind of get in touch with the HTC saying, hey, this is the date. Can we do X, Y, Z? With me doing surgeries through the HTC, the staff was there at that hospital because that's the hospital they round with. Right. Now, with shifts in how their departments run, I don't know what that looks like. But
Yeah.
I mean, in the 90s, oh my gosh, I mean, it was great.
Yeah. So, and I had an emergency appendectomy when I was 12, so that's in 92.
Mm-hmm.
Okay. And Tulane oversaw the whole process, and it was amazing. We were able to do that. But the way this happened, being so fast, now Tulane is in, the university, it's in a big transitional phase right now.
Mm-hmm.
And so I kind of got caught in the middle of that. The good thing is that the surgeon that had done all my other procedures, who is absolutely amazing. And to me, he was the best and someone that we were already close with. And he's got an incredible resume, traveled with the U.S. Olympic summer team. And I mean, the list went on and on. And he knew my knee. He had done those other procedures. Everything had gone so well. It's hard to move away from that. And he had tried so many different times and done so many amazing things. Even with the ACL replacement, like that was all something that when I had moved back from Tennessee to Louisiana, and I'm jumping around a little bit, but this is, I'm just so grateful to Dr. Bender and the team. But what they did was I could not get on insurance because I had just moved back into the state.
Mm-hmm.
And the program that we were on as kids at the time had been depleted. It wasn't even available anymore. And so they were in a process.
Like LA CHIP, Medicaid type deal?
Yeah. And so what they were trying to do was we were working very quickly to try to get that done. He ended up doing the legwork and literally had everyone volunteer their time.
Mm-hmm.
Nurse anesthetists, the whole staff got everything donated, including the cadaver patella tendon.
Yeah.
The hospital, all of it. It was amazing.
10 surgery.
Yes. Sorry. So I know I'm bouncing around, but again, this is one of the reasons why I was so dedicated and committed to having him do it. And he also, we didn't know this, but basically I got a letter when we got home from him doing the procedure that he was retiring, and I just saw him in a post-op, visit because he's moving on. Yeah, this is current. So he had done all these, but with the knee replacement, what happened is no matter what I did this time, it was going to take some coordinating between the Tulane, the HTC and the hematology staff there, and the new group that they were being a part of. What was great was Dr. Bender and Dr. Lessinger were now actually working together. So when the transition took place, that team, the HTC, they were melding into, and it was actually becoming one group. The company that I guess owns EJ,
LCMC, I believe, owns EJ.
Okay, LCMC. So they're the ones that purchased or like that process. There's some sort of like
LCMC is in the process of buying or has bought Tulane Hospital.
Right, and they're in the process of I didn't want to say the wrong group, but that's where Dr. Bender already was.
Mm-hmm.
So what happened was they were the two people that I needed to get together were actually doing it on their own without me being involved in any of that, obviously. But what's taking place is ultimately is I got a knee replacement out of it. Yeah. It just was done in a short period of time.
But in that 10-day period, let's talk about the actual coordination. Like, what did you have to coordinate? I mean, beyond we'd have a date now.
Right.
So what else was there that we had to coordinate?
So
I'm sure
trying to play middleman a little bit and helping messages get relayed. Just funneling information back and forth between Dr. Bender's office and then Dr. Lessinger's, which I'm telling you, Lisa, that the whole team, Dr. Lessinger is so amazing throughout this whole process. They were so helpful. They were on top of it. They were actually extremely proactive with getting with me because they realized we don't have a lot of time, and they were trying to throw this together
on a holiday weekend.
Right, on a
holiday week.
Like 2 days before. I mean, they were just amazing. So both teams were, but there was a lot of it was basically me trying to make sure that the information was getting to the other group as fast as possible so that nothing, and even with all of that and everybody working so well together, it's still almost the day or evening before almost fell through from what I found out when I was about to go.
Well, I mean, the coordinate, I guess this is what I was trying to get at, is that the coordination is the surgeon knows what they have to do,
right?
But the hemophilia team needs to know what they're planning to do in order to know how to treat you appropriately.
How long you're going to be in the hospital.
So how long you're going to be in the hospital. What dose of factor are you going to be on? Does the hospital have enough factor on hand? Do they need to order it in advance? I mean, there's so many things. And then the rehab, or are you going to use factor during all your PT rehabs and whatnot, and all these things. So it's really, they need to be in touch, and you have to facilitate that. But it's more than just saying, hey, you got a hemophilia, yeah, go ahead and do the surgery.
Right.
No, the teams have to communicate.
Right.
As a pharmacist standpoint, even making sure that you have the script in on time, so you have plenty of medicine for when you go home.
Right.
And then we have things like venous access. So myself, when I had my surgery, I had a PICC line, but you stuck yourself every day.
Yeah.
You have really good veins.
I do, and I've been really fortunate there too. But I've beaten the ones up that I stick often, but it works, and I haven't had any issues in a long time. So yeah, I'm still kind of in shock that it got done, because after so many years thinking like, okay, I got to get this done, and then hitting so many different walls and limitations, and then thinking, I don't know if it'll ever, because we did hit a time before my oral issues that I was just kind of like, we've done everything we could do. We've gone through these 3 hospitals, and maybe it's just not meant to be right now. And then having the oral issues, having to wait for those posts to heal, getting confirmation about that, the back and forth. And, we can jump into the oral part on a different day, because it's a lot of details involved. I learned a whole lot about malice. I learned a whole lot about infections. The difference between upper and lower jaw is a big difference. Some scary stuff actually happened right before we got it done. But we got it done. So yeah, I think having a good group is everything, right? So
yeah, having a confident team around you. You had a great surgeon. You had a great HTC.
First time at a hospital where they've done a hemophiliac knee replacement was also, it was new for everyone. So a lot of people were awesome. The nurses were amazing at EJ, but they were also, I could tell they were a little nervous. I remember
I was in the waiting area, and I think I guess you must have sent the message to Missy, or the doctor sent the message to Missy, and they were basically saying like, he bled less than a normal person.
Yeah.
But you had a ton of factor on board.
Right. So we had to do an IV push right before of what would be a normal dose of Benefix for me. And then they put me on a drip during the time. So they actually, all in all, when I went back and looked at it, they had done about 2,000 more units, which I metabolize. And this goes back to having a PK study. I would very much so encourage people to have that done. Just to see how their body is metabolizing whatever medication they're on. I think I know it's a pain. I know it's difficult, but it's worth it. I metabolize a very high unit amount. You've seen on a monthly basis, just for the prophylactic treatment alone, like I absorb and metabolize a heck of a lot of units of my factor product. So yeah, it was good. It took a total of 65 minutes from the beginning of surgery to end, which they were amazed by. But I also knew that Dr. Bender wanted to get me in and out as quickly as possible, because it helps with recovery, the potential, for infection, and just trying to get things done quickly, but doing it right. Side note is, as uncomfortable as I was, one of the worst things that happened before we did the procedure was I had my body basically was trying to cushion some of the grinding that was taking place, because it's so bone on bone, no cartilage, that there was cysts that had actually developed.
Wow.
And we're trying to cushion. And I appreciate my body for trying to do something, but it was the most uncomfortable part of maybe the whole process. Was I'm having this extra pressure now.
Yeah.
It's pushing my body and the bones in different directions. And it, internally, it feels way different. Something that could be microscopic, if you showed it on a ruler, of how much something moves, is unbelievably painful to the human body.
If you think about it from like a mechanical standpoint or a hardware standpoint, think about if you had hard roller wheels on a tool chest, or on your jack or your car, and you have a little pebble in front of it. Even the shopping cart at the grocery store, it doesn't roll over the pebble. So you got to think about, you have a little tiny cyst, your bones are hard. It's not gonna want to jump over that per se.
Or for anyone that's had a kidney stone, it could be microscopic.
Yeah, it could definitely be painful.
That sucker will make you hurt.
Yeah.
And so,
but here we are, you're post-surgery, you had 2 major complaints, your mouth and your knee, both of those were repaired. I know you mentioned to me a month or so, well, a couple weeks ago, that it's like, hey, I think my blood pressure is going down.
Yeah, that was another amazing thing. So one of the things that Dr. Lessinger kept saying, you and I talked about this a lot, because hypertension seems to be, if you're over the age of 30 and you're hemophiliac, it seems to be pretty common. Now, I'm hoping that changes with this generation that hopefully has not had the breakthrough bleeds or the target joints that we've had just over the years of not infusing. Yeah, so it was amazing because I get on blood pressure medication for the first time a couple years ago. It was amlodipine, and just the lowest dose was 5 milligrams. And they actually bumped it up to 10 about a month before the procedure because Dr. Lessinger kept telling me, I really feel like, because I've always had low blood pressure. Now, obviously, everybody has low blood pressure or normal blood pressure until it gets high one day. That can happen at any point in time. But it was just in coordination with seeing what was going on internally with my body. They thought, well, this is pain related, which I did not realize how much of an effect. I thought, well, yeah, that maybe that's playing a major role. Maybe it's not just that. Maybe it's my body's, doing that too, and I need to be more aware and take care of it. But I was perfect blood pressure after the procedure. When I was hurting, and it kind of proved it again in the hospital afterwards, it would spike a little bit, and I would get to see it in front of me because they're checking me constantly and doing blood work. But yeah, it was amazing. I'm back.
How's it now, like a month out?
It had me literally stop cold turkey when I left the hospital because it was so consistent over those 4 or 5 days of being right where it was supposed to be.
Have you checked it recently?
I check it every day.
And it has been still consistently normal?
The biggest issue for me was the bottom number. It kept jumping, and it's 80 now, every 80, 81.
I mean, it's the high side of normal.
Yeah.
Borderline normal, borderline not.
It's been crazy to not have to take the medication all of a sudden after a couple of years and have my blood pressure do what it's supposed to do. So it's regulated and kind of worked itself out. And it was because I was so uncomfortable. And I think one of the things is our pain scale, so it's so different for everyone, and everyone's so different in the way they process it. I think there's a lot of people like us that can file away because your brain just goes, oh, like for you, your ankle, it's like, well, this is just part of what I'm dealing with right now, and you can just go, this is a normal day. It's just uncomfortable. Someone else, it may hurt a lot because they haven't felt it, but for you, you've dealt with that pain for a long time, and you can just kind of file that away as a normal day unless something happens and you end up with a bleed and it's evident there's something else going on.
Yeah, I definitely think, well, at least I hope that there's going to be some sort of study done on hemophiliacs to correlate between maybe just hypertension or pain levels. I know that growing up when I was little, I remember asking the nurse, about heart attacks and strokes would be at increased risk, a decreased risk, thinking that, if my blood doesn't clot, what's the chances I get a blood clot and have a stroke or something like that? Yeah. And she's like, oh, well, we don't know because they don't have enough of y'all that's gotten old enough.
Not enough to add.
And then I remember maybe it was a couple of years ago, I brought up the same topic, and the doctor was like, oh, actually it's starting to show a trend that hemophiliacs, the older ones, are tending to have hypertension. Now, I'm curious if that hypertension is caused by the pain, or is it just inherent with the disease state?
That on the study.
It would be great to get some kind of data on that. But I know I've been struggling with the hypertension, but I also struggle daily with pain in my ankles, and it's just something that, as a personal choice, I don't take anything to alleviate the pain. I just kind of power through.
Tylenol every now and then.
Yeah, I just try to take what they don't recommend, like an Advil, a whole bunch of it when it gets really
I don't know about the whole bunch of it, but they definitely now are saying that we can take it.
Yeah,
not that often, but every now and then.
Yeah, so I do that from time to time, but rarely. But yeah, I mean, it's to the point where I'm curious to see. But I know I've been fighting with that hypertension struggle. And I mean, unlike you.
I was excited for you when I thought about it, because I know that you had a couple different occasions where you went in to see a cardiologist. And so I felt like, not seeing anything, I felt like you were fine. But at the same time, I know there was some concern there, and I know you were worried, but I know that everything looks good. It's something where I'm really curious to see when you're out of pain.
I'm curious too.
I don't know, obviously, because we're not there, but there's a part of me that's pretty confident that it's gonna drop dramatically. That's what I'm hopeful.
Well, now that you're post surgery, you doing physical therapy, things of that nature.
Yeah.
As a pharmacist, as someone that's seen a lot of people with surgeries, I mean, I can't stress the importance of stress enough the importance of physical therapy and rehab and making sure that you move those joints and get that range of motion back. Because as someone that's seen so many people and have met them, and I've seen what they're going through, some people that didn't take it seriously will tend to have less range of motion versus the ones that take it really serious. They were better than they were before.
Yeah, that's hopefully that's the idea, for all of us when we're having a replacement. This is the first surgery I've ever had, though, and it was still kind of bizarre, even though I was happy about it, because normally still, even as an adult, my parents saying like, you got to chill out, or my wife saying, you just need to rest and take it easy. It's the first procedure where they were like, hey, you can get up and go. You're not going to hurt it. They just didn't want me to fall and break the incision open again. Yeah. That was kind of weird hearing that over and over again. But, you saw me, I guess, what was it, like 9 or 10 days after? Yeah. It was about a week after when I got back to Lafayette. Yeah. And so, they wanted me on the walker, but, at the office and stuff or at the house, I was trying to push it a little bit. And then they told me I could. I just needed to make sure I didn't fall. Yeah. That was the big thing. And it wasn't because, again, it was not what I thought, where they were worried about me damaging what happened on the inside. It was all cemented in. It was actually the incision and just potentially creating an opening for infection or having to go back in.
Is your normal prophy regimen enough for you to go through this rehab or?
Yeah, it works out well because the regimen for me before was 3 days a week. And then I would have an extra couple of doses throughout the month in case I had, some additional bleeding. The prophylactic treatment, it really did make such a big difference for me. And I could tell the microbleeding. I didn't even realize, because I was so stubborn, did not realize how much less pain I was actually in by sticking to that schedule, which is what they were telling me. So I'm sorry, Dr. Lessinger and Singleton and you guys, because you were trying to let me know. But when I finally got to the place where I was like, I'm going to do this, it really made a big difference. And so I would encourage people. I know it's frustrating to infuse. I know there's so many things that are agitating about it, from probably not many people having to do it as well to, trust me, you're not alone in that frustration. But if you can get over that, and everybody's situation is completely different. It's like a different planet. Not only the amount of units, but the product, what the issues are. I would encourage you to stick to whatever the hematologist is telling you to do, because I know for me, in my experience, and for some of the other patients that I talk to pretty often, that regimen has really saved a lot of people a lot of grief. And so for me, I started sleeping better by sticking to that. But to answer your question, it was 3 days a week, like on Monday, Wednesday, Friday for me. And it just so happens that my physical therapy is 3 days a week. So when I have physical therapy, I just stick to that regimen. So for the next 6 months, I'll at least stay on that.
Yeah, that works out well. But as a pharmacist, I gotta say, Factor isn't a pain medicine. But as a patient, I will definitely say that when I'm hurting, it offers me some relief. And then maybe it's strictly mental, but I know that when I get my extra dose of Factor, my PRN dose, I just am at ease because I know that it's going to work, and I know that I'm going to feel better the next day. So, to a lot of
I'm similar.
It's not a pain medicine, but getting that extra medicine in can maybe relieve some of the aching and pain that comes along with microbleeds or joint bleeds and things of that nature too. So
help me rest better. Even with being uncomfortable, it would help me get a little bit more rest. And I know I'm the same way, and I don't know why it hasn't been brought up more often, but a lot of patients, and I'm surprised that this isn't out there a little bit more, but I know when I infuse and I've had any sort of a breakthrough bleed, even if it's early on in the process and it starts well, when I infuse, I know it's going to hurt more. And I think that was a deterrent as well. As crazy as it sounds, in my mindset, it was weirdly reinforcing, I want to put this off a little bit longer. I would rather be dealing with the bleed than I would with the infusion and then this exponential pain run that I'm going to go on for the next 2 to 3 hours. But still, I know that it's going to decrease the pain after the first. I know for me, and the way that my body metabolizes the medication I'm on, it's about anywhere from an hour and a half to 3 hours. And then even if it's not so much visible, physically I can tell it's working and it's doing what it's supposed to do.
Wow.
So
That's awesome.
yeah.
But yeah, I think there's a lot of great messages today. I think we've learned a lot about your history and the things that you've gone through. But I think the gist of what we've learned was that, hey, we need to have clear lines of communication between ourselves and our healthcare team. Absolutely. Having a healthcare team that understands what you're going through, that knows you, and that can take care of you. And having people in your team that you can trust, whether it's a family support, you have something as a pharmacist that may know personally and definitely will take care of all your needs as far as your medicine goes, your doctors that know exactly how to treat you, the surgeons that know exactly what you need, and just having clear lines of communication. I think that's so important. I think that's the general message of today. So I thank you for sharing that you had to share. I know I shared a little bit myself. And thank you for joining us today. Please, if you have Facebook or Instagram, follow us at FactorCareRx. And don't forget to like and subscribe on whichever platform you're tuning in on us today. Thank you.
Appreciate it.